Hi, this is Melissa Doman with Melissa Doman Sleep Consulting, answering the question, does autism cause sleep problems? Now, I'll admit this is a little bit of a loaded question. For some parents watching this video or reading the transcript, it can feel a little bit like a chicken or the egg question. Your personal experience might be that your child was diagnosed with autism, then sleep started to become an issue. Or your child experienced a massive sleep regression seemingly out of nowhere, and that's what started a longer search for answers, and then your child got the diagnosis. Now, you are a parent searching for answers for your kiddo. You want a better understanding of your child and how they are individually wired, and you're probably searching for some advice about your autistic child's sleep problems. And my guess is that it's probably about 2:30 in the morning or so. Now, I could be wrong, but that's my guess. So first off, let's quickly answer the question, what is autism? Now, do a quick search of this question and you'll find loads of sites that describe autism as a disorder. Some sources will define autism as a neurodevelopmental or even neurobehavioral disorder, which can affect speech, social interaction, and more. But the key part of these definitions is this little bit neuro. Yes, neuro, which stands for or which means the brain. Okay? And that's because the brain is our command center. If things are not running smoothly or efficiently, it's going to affect how we function. So if a child has difficulty with communication, sensory processing, regulating their behaviors, it is because the brain is disorganized. Now, many different regions or areas of their brain are affected because of the lack of connections or mixed signals. So this is why autism is so unique to the individual, and that's why it's considered a spectrum disorder. And that's because different regions of the brain are affected. So for example, that's why we sometimes see children who are not yet verbal and other kids on the spectrum who can talk their heads off. Now, why is this definition important? So it's important to understand that regardless of how your child developed their current sleep problems, sleep is an incredibly complex function of the brain. When we sleep at night, our brain is going through an ongoing process of cleaning, organizing, strengthening, and more. So when a child has neurodevelopmental issues, this is what can throw a wrench in the works. When there's already chaos in command center, it means that the functions that we cannot see will also be hindered, not just the things on the outside. So it's not autism that is causing sleep troubles for your child. Okay, it's not autism. It's how their brain functions, which is causing the sleep issues. So when this is properly addressed, the brain is able to do what it needs to at night more and more efficiently. Okay, and let's think about this a little bit or pose a devil's advocate question, right? If autism caused sleep problems, wouldn't everybody with autism sleep poorly? Right? Let's think about that. So let's answer the question, why can't your autistic child sleep? Now, over the last 6.5 years, what I've learned working with hundreds of kids on the spectrum is there are a few major reasons why good quality sleep is hard to come by. The first of those is sensory processing issues. When the brain is not getting enough stimulation or gets too much stimulation, it's going to be agitated. The most common side effect of that agitation are those god-awful middle of the night wake-ups that kids have. They last for hours and hours. So this is the child that's up anywhere between 1 to 4 a.m. and just won't go to sleep despite everything that you do. And parents will tell me that they see their child is exhausted and wants to go to sleep, but they just can't do it. The second thing is nutrition and health issues. So many children I've worked with are incredibly picky eaters. So it means that they're not getting the vital nutrients they need for a good night's rest. And picky eating is very often a sensory issue. So if your child is not getting enough animal protein, calcium, vitamin B6, their body will be unable to produce the melatonin it needs to go to sleep and maintain sleep at night. In addition to this, if your child is a picky eater, chances are that their digestion is pretty irregular as well. Now, whether that irregularity is constipation or diarrhea, that's certainly not going to feel very comfortable to them at night. And we've all been there. We know that this discomfort won't necessarily mean we'll be able to rest easily. Now, the third and final major reason when it comes to sleep struggles is a child's inability to self-soothe. So in addition to the issues I've listed so far, most children I've worked with are just unable to self-settle. Often this is related to sensory issues. So for example, some kids need the tactile pressure of someone lying with them, or they need to have a bottle or breastfeed in order to regulate. Sometimes it's a matter of a child not being able to communicate what they need or want. So when your child lacks the language to say that they're hungry or I need the bathroom, isn't it just easier to have a parent there with you? Maybe your autistic child also struggles with anxiety. Again, it's easier to have someone there to help them regulate and calm. So the big question, how do you solve this issue? How do you get your child with autism to sleep? So first, I strongly recommend starting with the 5 tips for better sleep. These are the foundation of what my team and I teach our families day in and day out. Now, by following these, this sets your child up for success when it comes to falling asleep better regulated, satiated, and more. And we have had dozens and dozens of parents see almost immediate changes just with these tips alone, okay? Now, if you know your child has any kind of sensory processing issue, your occupational therapist may be able to guide you on a sensory diet that you can do at home. Or if you know nutrition is a concern, consult your pediatrician or local nutritionist for recommendations. Now, that being said, my team and I understand that to get lasting results in a child's sleep, it's important to get down to the root of the issues. Again, it's not the autism that's causing the sleep problems. It's the disorganization in the brain that's affecting the sleeping process for your child. And again, each and every one of us is trained in sensory techniques, the nutritional changes, sleep hygiene, gradual sleep training to help your child thrive and grow with a great night's sleep. The journey to a great night's rest is not going to be a short one. It takes patience, consistency, and the right plan to help your child sleep well. And we're here to help. We know it's a marathon, it's not a sprint, and we're going to be with you every step of the way to help your child with autism get a better night's rest, day in, and night out.